This
Where's,
conference will now be recorded.
thank you. Is she on the payroll?
Well, go ahead and introduce us, and then I'll just say a couple of quick words.
Thank you, everyone, for joining us, both all of you who are new, as well as those who have been with us before. And I did notice Stacy came in, but she disappeared, so maybe Jim's helping her come on board. But I am Michelle Nadine Baker, and I am your lead moderator here for the Blood Cancer Support Group. And I'd love to introduce our newest moderator, and that's Sally. She has been a loyal member to our group, and she's also extremely knowledgeable. And I'll let her tell everyone about herself in a second. And also we have our fearless leader of AnCan, and that's Rick Davis. And
yeah, and I was actually going to welcome Sally, because we're so thrilled to add Sally to the moderator team as a exceptionally knowledgeable multiple myeloma person living with multiple myeloma. Sadly, we lost Tom Henry. He was just oversubscribed and couldn't keep up with what this was taking. So he asked to resign, and so we replaced him. We replaced Tom with Sally, and Kenny is here sometimes and sometimes not. We're not sure about Kenny. Are we expecting Kenny to moderate tonight, Michelle?
he said he's hoping to drop in. I knew he wouldn't be here right at the start, so
Okay.
yes, because he has the kids tonight. So it all depended on how things were going.
So I would suggest you have two new people. I'm going to cut out in a minute and just listen, because I'm not a peer in this group. I'm just really here to help the moderators. You have two new people, and you might just want to visit with them, and this number you'll have plenty of time.
Okay, great. And also, if you're not speaking, everyone, if you could mute yourselves, that's great.
Right.
And okay, so is Debbie? She still may be dining. So what, Dina, would you
Yes.
like to tell us a little bit, and please share as much or as little as you want about yourself, but welcome to our group, and I'd love to hear a little bit about you and what it is, which blood cancer you have, or if you're a care partner, and where you are in your journey.
Okay, so I have multiple myeloma, and I was diagnosed last October 13th. It took them about 3 years to find it. I am now about probably 170 days out or so from my stem cell transplant. And so I'm at Atlanta, and I'm at Emory. And yeah, I've got my dog here with me, and my husband just got home from work, which is kind of early for him. It's 8:11. He pretty much is working around the clock for the past 18 months. COVID has just made his work even more demanding than it's ever been. And I have 3 kids, one in Boston, one in Delaware, and one in Utah. And so I will be seeing 2 out of 3 this upcoming week, which I'm very excited about because I do not get to see them often. So it's exciting. And I'll be heading to Florida, where COVID does not exist. So you don't have to wear a mask in Florida. It pretty much doesn't exist in Atlanta either, so you're all good. You can come on down. Safe here. COVID didn't come this way.
Now that it's getting colder up north, that sounds pretty good, especially if there's no COVID, and that's why you all don't have to wear a mask down there, right?
Yeah.
And what is your dog's name?
Natalie.
Oh.
And Natalie goes with me pretty much wherever I go. This is my second life-threatening illness she's been with me through. She's 12 now, and she's getting a little old, and but she's doing good, and yeah, she's still with me everywhere I go. It never fails. I get up in the middle of the night, and I go up and down stairs, and I sleep in various and sundry places, and she just tags along.
Oh, Well, welcome to you and Natalie, and I'm sure Sally and you will have some words of wisdom for each other later on. If you want to speak again later on after the meeting starts going, please let us know. We try to, for everyone who wants to speak, and not everyone always does, and that's fine, but we try to allot time. So thank you for being here.
My pleasure. Thank you.
Can I just check in with you? Is there anything specifically about your myeloma treatment right now or where it's going that you would like to raise? We can talk about that right now. What happened? What's in
Well, right now, the Revlimid is starting to, the side effects are starting to show their ugly head. For some reason, I haven't had anything. I was really sick during the very beginning of treatment with the Dara and the Valcade, but I've been fine. I've been great, and now I'm having the joint pain and the headache, and sleeping is awful. Just annoying things, really. Um, and I am pretty much researching stuff every single day. So I went to my PA. So I see the PA now monthly for a checkup, and then I get an IV for Zometa to get my bones built up again. And I asked her about low dose naltrexone, and I asked the psychiatrist about low dose naltrexone, and I got from the psychiatrist, she was like, this is such a wonderful drug. Why is it that I'm not reading about it in any of the literature? It's not in any of the conferences I go to, blah, blah, blah. And then the PA's like, I don't know anybody on that. And so I call the palliative care doctor, and he's like, yeah, absolutely. I think that's a great thing that we should try. And I have lots of patients on it. And I don't understand why these physicians don't know about it. So I started that about a week or so ago, and so far I'm off the gabapentin. Only took a week.
Yeah.
I'm really. Why are you shaking your head,
Oh,
Sally?
gabapentin. I'm not a fan of gabapentin.
Right. So I want to get it out of. I just take so many drugs. I'm like, oh, I can't stand this. So if low dose naltrexone can take the place of 3 or 4 other meds, I'm like, yes, I like that.
Are you
Right?
taking Claritin daily?
No.
Claritin will take care of your bone pain.
Okay. So
Take it every morning
Okay, so just like when
and
you were
just,
taking it for when they were collecting stem cells.
Mhm. I
Okay.
take it daily, and it has to be Claritin and
Mhm.
not the Claritin D. Don't use CVS, generics or anything like that. For some reason, it says it's the same drug, but it doesn't work the same.
There's a big article in New York Times several weeks ago that's still upstairs that I have to have time to read it and the patients to read it. It is very alarming and upsetting about generic drugs.
Yeah.
Very upsetting. They
Yeah.
just
But
say
that'll
it's
help
the
with
biggest
that,
drug.
and alpha lipoic acid will help with your neuropathy if you have it from Velcade.
I started to have it and then it kind of disappeared.
Good. Maybe
Yeah,
they got
and
it
then I think
first.
with the ALA, there's a B something that they put with it. It's a B6, I believe.
It,
Yeah.
it's part of your natural vitamins you take every day.
Yeah. B6 is if you've got any neuropathy, B6 is suggested as being a pretty benign answer. My cancer was different, but I'm familiar with gabapentin and I'm familiar with Zometa. I got all those good things too.
What about the Revlimid? Did you get the Revlimid?
No, that was not no. That was fortunately that was not. You wouldn't want what I got. we won't go. We won't go there. But I'm Sally. I'm thinking that you may have some more tips other than just the Claritin, Vadina, in terms of some of these side effects.
I'm assuming when you say side effects, you're talking about GI problems.
No, I have none.
Well, that's
I
fantastic.
didn't have anything from Malfolin. Nothing.
Right.
No,
Now, are
it's
you
more or
on 10
less,
milligrams of Revlimid?
yes. So it's like a low-grade headache, it's the muscles, it's the sleeping, it's just annoying things, nothing life-threatening,
When are you
just annoying.
taking your Revlimid?
In the evening.
Okay, take it right before you go to bed.
Yeah, I do.
And try to eat 2 crackers or something after you eat it, and that'll take care of your headache.
Okay.
I mean, I eat Ritz crackers.
And let us know next month if that helps.
Is there a reason why it has to be a carbohydrate?
No, it's just
Or does it
what
just
one of
have
the nurses told me, and it's just to put something in your stomach.
Okay, with food. I'll
What are
try it.
you doing? Sorry. I have an animal who is creeping up beside me. What do you want?
And Lynn, when you were on the Revlimid, did you suffer any of these side effects?
Are you hearing me okay?
Yes.
Yes, sir.
Okay. Um, I don't recall any specific side effects. My diagnosis is um, a, the twin to CLL. I have SLL, and so my doctor said let's try Revlimid and combined with rituximab. And I'm talking to somebody. I'm talking to somebody. So we've got grandkids. We're babysitting the dog this weekend, but yeah, I mostly think my side effects were probably attributed to the Revlimid. Excuse me, attributed to the rituximab monoclonal antibody because I was taking that on a regular basis monthly. But I don't remember anything specific for about um, Revlimid, also called lenalidomide, I believe is the other name for it.
Yeah.
And it's a derivative of thalidomide, which caused birth defects
Oh,
back in the
yeah.
1970s. Yeah.
Yes, I have to take a pregnancy test every month. It's very exciting. And then I have to have 3 different interviews from 3 different people telling me about all the things I have to do and not do and how to do it. Very
Dana,
exciting.
Wait till you've done it for 2 years and they have. Now I'm only have to do my interviews every 6 months.
what
I do it
what
every
what
month. It takes
what
about
is
an hour and
the?
a
Yeah, I was going to ask, what's the expectation on the stem cell transplant? How long of a remission can you expect with that?
Anywhere from 5 to 20 years.
Okay, very good. And it can it be repeated? And it's
Yes, but by the time I might need it, I don't know about you, Sally, there might be something out there that they won't have to do it, is what my doctor told me.
There's
okay.
just not longevity on the other treatments like CAR T and BITE. They only last about a year. So that's
Wow.
why they haven't replaced stem cell transplants yet.
But after the stem cell transplant, you do continue on a drug like Revlimid.
As maintenance, yes, but a
Yeah.
lower dose.
Yeah, 21 out of 28 days, forever.
And you're on maintenance anywhere from 3 to 5 years, depending on your MRD status.
Oh, I thought it was
You
forever.
No, if
you you
you're MRD negative after for 3 consecutive years, most of the specialists are saying you can get off of it. Some go to 5, but the worry of a secondary cancer by using Revlimid every day
Exactly.
is higher than you would want it to be. So that's why you can get off of it after if you're MRD negative. If you're not
Yeah,
MRD negative, it doesn't make any sense to get off of it.
so for some reason, they did not check that. Like the doctor was like, what do you mean they didn't check? So I won't know that status until I have a checkup probably next March. I'll get another
Bone marrow
bone marrow
biopsy.
biopsy. Yeah. Sally, do you have any recommendations for fatigue?
For what?
Fatigue.
Yes.
Actually, exercise.
Okay.
Whose background is that?
Yeah. Whoever it is, they're not even showing up on
I think it's this person over here, the new person.
I know somebody's trying to get in, but I can't see them yet.
No,
I mean,
I
I don't
can't.
see a box yet.
Ooh, I can't see him either. Otherwise, I
No,
would
it's just a C.
silence.
He's your friend
Ooh,
in Argentina.
That's
how
better.
last time.
yeah,
Yes.
I think it might have been Jim Marshall trying to get in, but he didn't show up, and so.
I just muted him, so.
Oh,
I
you
don't
did?
even see him.
Because I couldn't. Thank you. I can't see him. He's not showing up on my list. So good for
Me
you.
neither. That's the great
He's
thing.
on mine.
Yeah. So good for you. Let's come back to this fatigue, because do have something to say on the fatigue, Dina.
Okay.
And some of the other people in this group might endorse this, but this is true for solid tumors and for blood tumors, and as weird as it sounds, if you can get into a regular, you look like you exercise. I don't know if you do, but you look like you do.
Yes.
But exercise can really help you. It sounds counterintuitive.
Oh, no.
If you can get your your pulse up and your heart rate up for at least 15 to 20 minutes, if not more, it's a wonderful drug.
No, I agree with you wholeheartedly. I didn't know if there was anything else. So I just talked to my palliative care doctor, and he is going to test. He's going to test my B12 levels.
Mm-hmm.
So maybe get B12 shots, which is something I did for years, many years ago. And then my dog just needed them because she had pneumonia all summer and was not her normal self. And she was back to being normal. I was like, all right, maybe we need to go back to the B12 shots. And so he was very open to it. He's anything I suggest, he'll think about it and talk about it. And,
Well, I think, first of all, I meant to say this before, huge kudos to you for having a palliative care doc on your team, because that's a recommendation we make to everybody. And a lot of people don't understand the value of a palliative care doc, and they confuse that with end of life, which of course it isn't. And we truly believe that there are many tricks that the palliative care docs have in their bag that the oncologist does not. And so good for you. Is the palliative care doc at your cancer center, or is it an independent practice? Or
nope, it's all at Emory. So, within my system, I have a social worker, a psychiatrist, the pharmacist, a dietitian. I have the palliative care doctor. I have a physical therapist, and then I don't know, there's 3 or 4 other docs that are just working to keep me moving well.
That's excellent.
Ashley, hold on. Ashley, you got to run? Are we going to lose you? Oh, Ashley. I think she's frozen. Are you there?
She's frozen.
Yeah, she's frozen. Oh, what a bummer. Oh.
I know, because Ashley, no, not there.
No.
I think she is frozen, but she said darn.
Never mind.
Oh.
That's how it goes. It's okay. Yeah, it's good. I mean, I've been trying to get my buddy Al here to get a palliative care doc on his team, and he's promised that he's going to ask next time he goes up to Mayo, because I know that fatigue is an issue for you too, right, Al?
And how about anyone else? Has anyone else had that? Have you had it, Lynn, with the Brutinib and Bruvica?
Yeah, I do have fatigue. And I've said before, it's like it hits you like going over a waterfall. All of a sudden, you're level. We were having breakfast this morning with our daughter, and I told my wife, I've got to go to the car, lay my seat back, and I just have to go and rejuvenate. and it can happen. I have to be really watchful when I'm driving. We're about 400-mile trip to MD Anderson in Houston, but I have to be careful anytime I go on a long trip like that I don't overdo it, because when you're driving, the fatigue can be there and you're not even aware. But what's happening is you're losing focus.
Mm-hmm.
Yeah. Yeah. Yeah.
Mm.
I suffered from great fatigue on it as well. And
On the Revlimid?
no, on ibrutinib, otherwise known as Imbruvica, which Lynn is on. And I don't know if anyone else tonight, I don't think anyone else here is on that tonight. I'm not sure, since we haven't spoken yet with Debbie to
It's
ask her.
part of the BTK inhibitor, if you've heard of those.
No, I haven't.
Go ahead, Michelle.
Anyway, so, and I was already exercising. I had never stopped until COVID, but I can't blame it on that anymore. And I was exercising. The point that I was taking a class at Dana-Farber Cancer Institute in Boston, how to regain your energy. And they're like, well, if you already exercise, you got to turn it up. And so I was doing pull-ups, and then I decided to add this other thing that made it even harder. And I tore my rotator cuff by turning up but they were like talking to people who didn't exercise, right? Like people who just didn't move at all, which has kind of been me now during COVID. Not totally, but I just feel like that now. I can more appreciate that. And I was just like, then I had to start doing physical therapy, but it was kind of interesting. And they're like, what did you do? I said, I told you I already, was doing cardio every day and weights and classes and yoga. So sometimes, and I do know that for certain drugs, it just is a side effect. Is that a side effect of anything you're on? Is it a known side effect? It is.
Yeah.
Doesn't Revlimid rev you?
No.
Oh,
That's Dex.
Oh yeah, that's what I'm thinking of. Exactly. The dexamethasone. And so is that something that you only take during treatment, or you still?
No, you only take the Dex during induction.
Well, some people have to take it as maintenance. Thankfully, I don't have to.
It's not the standard of care.
Okay.
That's the one I was thinking of, that I know that also some CLL patients get that as well.
Yeah, I've just met people who are on it, but I hope that I never have to go there. But it was funny, during induction, they would give me a bunch of steroids, and then so they would give me the dexamethasone, and then they would give me the what's the other word? Brain fog. Can we talk about brain fog?
You're talking about prednisone, steroids?
No, it's dexamethasone, and then they would give me the other thing
Benadryl.
that makes you sleepy. And I said to the nurses,
Benadryl.
yes, thank you.
Benadryl.
Yes, it's a word we all know. It's an easy word. But the Benadryl would win over the steroids. And I had extra steroids because I kept reacting. So that was kind of crazy.
But just to let you know, Dina, it took me almost 2 years to get after my stem cell transplant before I had any energy to do anything.
Okay.
It may have been complicated by having a knee replacement at the same time, but it's only been in the last 6 or 7 months that I've had energy to do anything. I mean, I drove to Oregon, which is about 3,100 miles round trip 2 weeks ago. So
amazing.
I wouldn't have been able to do it a year ago.
That's awesome. Wonderful. Congrats.
So just, I know it's nice to feel like you've got everything going at 170 days past the stem cell transplant, but even my antibodies and gamma globulins haven't even come back, and I've been out. I had my stem cell transplant in March of 19, so I'm still going.
Okay, good to know. Is your brain fog gone?
No.
You can't remember
I can't
any
remember
words?
what I had for lunch.
It's so embarrassing. Just like makes me crazy.
Mm-hmm.
So one other drug that I've seen used, I'm not a fan, but some of the guys really like it, is Ritalin for fatigue.
Yeah.
And as you know, it's usually a drug given for ADHD,
Mhm.
but it might be something that you want to raise with either your onc or your palliative care doc, and see how you do on it.
Okay, well, thank you.
So for, that was something that I know that there's actually at MD Anderson, there is a fatigue clinic, and that is in the arsenal that is used if all else fails. And also at Dana-Farber, that would come under palliative or psychiatry.
Mhm.
So depending on who on your team, but it really makes the world of difference for some patients. They do all kinds of cognitive tests first, because I've gone through all this testing for it. And I'm actually on it. I don't usually go around talking about that, just because I know for youth, there's a lot of abuse of it. So,
Right.
and that's why I usually don't talk a lot about it. But yes, it's made a profound difference in my life. So,
Well,
Lynn, when I've hit that wall in the afternoon, then that's the time that I would take something very, very low dose, and it would be enough to help me make it. So I don't know if they've spoken to you, Lynn, about that, or the fatigue clinic at MD Anderson.
No, I have not been to I didn't know they had a fatigue clinic, and that is interesting.
Dr.
My
Escalante is the head of it, and I can't remember her first name, but I can find it for you and send it to you.
Okay.
And
Uh,
Tina, I would think it sounds like you have such holistic, like they think of the entire patient at Emory. They don't have anything like that. Well, at least that I know of where I go. And that sounds fabulous.
Well, I just came across, so Kevin from Atlanta, he's in one of my groups, and he introduced me to the Piedmont Hospital here, has a whole program for any cancer patient anywhere. And right now everything is online. So I did Tai Chi the other day, and then I signed up for, oh, they have art, and they have more things like yoga and studying yoga philosophy, and they have cooking classes, and there's a calendar, and so every day there's 3 or 4 things, and anybody can join.
Thank you. That's a great thing. Piedmont Hospital?
Piedmont Hospital. I'm going to pull this up to see if I can find like the name of their newsletter.
yeah. So I will just do a quick plug, and then I think we should move up to Debbie. But we have Michelle's aware of this, and she had to recuse herself. But we have actually requested money to do an art program several times a year. That will is basically an online art therapy program. We've actually done 2 sessions already for our MS people, but we want to expand it to everybody. And we've asked for some money through Janssen. And since Michelle is on the committee that makes the decisions, she had to recuse herself. So we don't know if we'll get it or not, but if we do, we'll be providing some art programs as well, we hope.
And what was the name of that organization that came up to talk about I'm kidding. When it came up, it was, yes, I did read through it, by the way. And I think that is an excellent program.
Yeah. Yeah,
I'm
we're
not speaking on behalf of the
about it.
committee, but for myself.
Yeah, no,
Best
I mean, we are excited about it. And the woman who is lead is a young person in San Antonio with multiple sclerosis, and she's really good. So, and the sessions have been very good. Anyway, let's go to Debbie.
Hi, Debbie.
You have to switch your microphone on now, Debbie, because you're not eating.
We can't read it.
She's frozen.
Oh, I can. I am not on any meds. I see Dr. Siddiq. I don't want to. Key? City,
City of Hope.
it's out, City Hope. You're seeing him
Can
next
we
month.
see that?
What kind of patient are you? CLL, multiple myeloma, AML?
CLL.
I am as well.
Yeah.
And have you just been diagnosed? Just diagnosed recently, or?
Year ago.
Thank you. We also have the chat. Do you see the chat function if you want to? Oh, she may have frozen now.
Yep, she's frozen.
Oh. Debbie, can you hear us? Because you're frozen on our screen. What happens when you freeze? Do you have to leave and come back, or do you eventually unfreeze, thaw out?
There she came back.
She's coming back in again.
The connection today is really bad.
Yeah, I
Here
think
you are.
we need you.
There she is.
Yes, we need you to enable your microphone, Debbie.
Not working. Oh, there we go. Is that working?
It is working.
All right. Yay. Yay.
Hooray! Tell us
Yeah,
about.
I was diagnosed with CLL in January after a routine yearly physical. And I've been seeing my doctor every 4 months, and we're in the watch and wait. But you guys and somebody else says you should get a CLL doctor. So I asked my doctor, my oncologist, hey, should I get a CLL doc? And he said, that's a great idea. Go see Dr. Siddiqui at City of Hope. So he's sent all my records. I've got paperwork to send to them, and I see her next month. But my hope is that she'll just be a consultant, and then I'll be able to get my care here in Santa Barbara.
How
Because we know
far
that
LA for you?
LA, so it's about 2.5 hours to get there.
Well, you might go back and forth too. There might be times when you're seeing your City of Hope specialist more than your local doctor, or the other way around. But do you, within your CLL and your diagnosis, has your doctor mentioned anything about your, if you're like stage 0, early on?
Well, he kind of changes his song each time I see him. First he said, 10 years, and then he said, you're not going to need any treatment for 4 or 5 years. We'll just keep watching you. And then the last time I saw him, he said, well, I think there were some mutations, so it would be a good idea to see a specialist. So I said, fine, I'll do that. So I'm sort of in this neverland. He doesn't give me a lot of information.
And is your doctor a
Who are you
hematologist?
seeing in Santa Barbara?
I'm seeing your doctor too. Dr. What's his name? Gosh, talk about brain frog here. What is it? It's not Goodman. It's something like that. So he's an oncologist, hematologist.
At Ridley Tree?
He's at Ridley Tree.
I only see my specialist once a year. I mean,
Sally, who do you see there? Because you told me that I should know more than he knows.
I see Dr. Krishnan at City of Hope and Dr. Newman at Ridley Tree.
Yeah, Newman is my Ridley Tree guy.
Yeah. You should know more than he does.
Yeah. Yeah.
I mean, he's nice and everything, but I found, at least in multiple myeloma, he is not up to snuff with everything. And so that's why I rely on my specialist to tell him what to do. But I do get all my inductions and infusions here, and only had to go to City of Hope for the stem cell transplant.
Okay. And there's a couple new docs at Ridley Tree now. A new oncologist, hematologist who is young and apparently very nice and very smart. So I may check him out too.
Yeah, do that, because, knowledge is power.
Right.
So the more you know, the more it can be a joint decision rather than having one person telling you what you should be doing.
Yeah.
You have to weigh the balance of the side effects and the cost and the inconvenience and the quality of life and,
Yeah.
progress. Well,
And the other scary thing is that I've been a hospice nurse for over 20 years. So I certainly know a lot of palliative care docs in town, but that also sort of flavors how I feel about dying. So I asked him, so, I was a hospice nurse for 20 years. I never took care of anybody who had leukemia. I think that's too strange. And so how do these people die? What happens? And he was like, well, sometimes they get infections or they get pneumonia and they die in the hospital. That's what happens. So, it's maybe it's a question that I ask because I'm interested in death and dying. And the law in California just passed. Yay.
What
Oh,
law?
really? So,
Yeah,
the right to die.
the right to die has been changed. The governor just signed it. So instead of waiting 14 days and 2 doctors, you
yeah.
can, in 1 or 2 days, if you're having a crisis, you can ask your doctor and they'll give you the medicine. And also,
And
I talked to
how long do you have to have been sick to be eligible to ask? Because there was a long waiting period in the old bill.
well, the old days was 6 months
Yes.
because you would be on hospice, which would be 6 months. But nowadays, it's if something is diagnosed right away and you have terrible pain and symptoms can't be controlled, you can request the medication. And this is
Wow.
another cool thing is that not only for people who have a hard time swallowing it, they're giving it rectally now. And they, one of my nursing friends called me and said, Debbie, we're giving it rectally. It works in minutes. People are dying usually in 15 or 20 minutes. So it's actually been working better for some people than the oral route, which is pretty exciting, I think.
Debbie, I do have many questions for you, but I just want to find out, I'm sorry to break in, but caller 00.
So somebody's on the telephone.
Who are you? Could you introduce yourself to us? Because we don't see a name and I don't remember anyone joining us with that ID before.
So somebody's on the phone. If you just like to identify yourself, that would be great. And if you just would rather listen, that's okay too. So
But if-
anybody
Yeah,
anybody
just if you're wondering if you're in the right place, you're in a patient support group for an AnCan blood cancer support group.
right?
But
So in
was
case
caller 00, was he muted by the moderator?
No.
Oh, it's
If you-
Jim Marshall. And it's
Wait.
Jim Marshall.
Okay.
I see. And you are when you're muted right now, I think, because of the feedback. But we got it, so we'll change that to Jim Marshall, and hopefully, if you want, we'll bring you in. We'll try and hear you, Jim.
I thought we were getting whatever the equivalent of Zoom bombed on GoToMeeting. I wasn't, because I've had this happen on work things and it's not good.
No.
So Debbie, I don't know if you've gotten to this point, and I know you said it's because it's what you've done in your life for work, but they say that with CLL, that it's becoming truly a chronic disease, as the name says, and that something like an infection is more likely to happen that you would pass from versus the disease. Okay.
Yeah.
I just want others to hear that so they don't think, oh my God, I have a death sentence, which hopefully will not be happening. So what are your prognostic indicators? Your markers?
I don't really know. I don't have an answer for that. I mean, I've looked at my labs and, my white counts elevated. There was some pathology done that I looked at, but he didn't explain it to me. Maybe Dr. Siddiqui will be able to give me more information about that.
Or do their own, have you had a FISH test? That's really what I was looking for, to see. That would show, that helps determine and CLL is so odd in that we're each different, even if we have the exact same markers, but it kind of helps them predict how you're, how fast to treatment usually. They can guesstimate on that.
Okay.
And a FISH test shows that. And it would be things like 11q deletion, 13p, 17p, TP53. I know it sounds like an alien language, right? If you're
Right.
unmutated IGHV. So those are some of the things that they would be looking at. But I mean, with your being a nurse, you would have noticed that there's this other kind of information being given. And not all generalists, hematologists, oncologists do those tests if they're not knowing, if they're not a specialist.
Yeah.
So,
Yeah.
Which may be Newman.
Yeah, if that test is not done, I don't know how your doctor would be predicting how long you'd be watching weight. And it's also used to determine which treatments might be best or which ones would not be of choice. So, absolutely, that needs to be done before you start treatment.
So it's called
It's
a FISH
exactly the
test?
same as multiple myeloma.
Okay.
the same test, the FISH, it's
FISH and next generation sequencing. Yeah.
right. It's,
I'm T1114, so, and 13q32.
So you have a 13q as well. That's really interesting, as we do.
Yep.
But with and you'll see, Dina and Debbie, that within the blood cancer community there are some similarities between different ones. That's interesting. I mean, it's like for us, it's just interesting to hear that. And some of the same, if you're already hearing on the medications, some of the same ones are used for different blood cancers or in combination. So Debbie, the other thing is a flow cytometry, which they may have done or maybe not. But the FISH test is, like Lynn said, it's kind of the key to
Okay.
what's happening. So maybe your doctor did do that, or maybe, and also they've been tracking, you said, since January. So that's 10 months. When did you say you're going to City of Hope? Next month?
Yeah.
Oh, great. Thank you. I was trying to think, thinking Lynn just posted what FISH stands for. I was like, fluorescent, and I knew the in situ. I'm like, okay, what is the H? I was kind of close on the F, yes.
So what was it that you were talking about that Sally said we have that too? You were all talking Chinese as far as I was concerned. I
The
didn't
FISH
follow that
test
at all.
and the cytogenetics, the FISH test and the next generation sequencing to determine what kind of myeloma or leukemia you have. And it helps in determining what drugs are going to work and whether or not you have high risk or standard risk.
I hadn't heard anyone refer to it as a FISH test, but
I beg your pardon?
I hadn't heard the term FISH test, but yes, I know what you're referring to now.
Okay, so it's all the cytogenetics.
Okay, yeah.
Yeah, sometimes we hear people say, "What are your markers?"
Yeah.
Kind of the same thing.
Uh-huh.
Or what are your genetic markers, your prognostic indicators? I know. Look at how smart we all are together, huh?
But it does not come from your CBC.
Correct. And Debbie
only comes from a bone marrow biopsy.
Well, no, the FISH test is by blood.
It can be either one. For those
not in multiple myeloma. It cannot be done in the blood.
Because the disease is not showing up in the blood. Correct. It has to be bone marrow.
Correct.
Whereas with CLL, they do flow cytometry, I think what they call it, to get the, well, let me think about that. That flow cytometry and FISH test are probably two different tests. Yeah. Since I've got lymphoma, SLL, I had the bone marrow biopsy.
Well, I had that too for more fun and games, because heaven help that, why would they want to leave us out of that? But yes, but Tom Henry had shared with us, didn't he, some months ago about clonoSEQ?
Yes.
The new test.
clonoSEQ. Yeah.
It's a blood test, so they don't have to do bone marrow biopsies anymore,
no,
right?
it has to. No, clonoSEQ is, for lymphomas, yes, but clonoSEQ still has to use bone marrow biopsies for MM.
He
Because
was
I
saying,
have had the clonoSEQ test.
you have, yeah. So he was saying for himself, where he goes, that they didn't have to do the physical bone marrow biopsy on him, and not everywhere. I mean, where I go, they still do it the old-fashioned way with a. I hear anyone if they haven't had one, because if they haven't had one, they can have their own delight on the first try, but
don't they give you anesthesia for that?
not
Yes.
me.
I've had all mine
Because-
done under sedation.
Yeah, I think they're using sedation now. I mean, because I
No.
asked him, should I be having a bone marrow test? And he said, do you want one? I said, well, do I need one? And he said, no, we can tell it by blood test now. You don't have to have that.
Oh, so
Yeah.
maybe
The only multiple myeloma must have a bone marrow.
I'm so sorry to hear that.
Comes
So
from
with-
bone marrow.
But it's really, you know what, now it's really not a big deal anymore. Like the first one, I had a really bad experience simply because a hurricane had gone through. Atlanta had absolutely no electricity. I live an hour out. We had no electricity. Trees are down everywhere. I had a horrific migraine. I get there and I'm crying hysterically, and the doctor's like, "What?" No, the nurse said, "What's wrong with her?" My husband's like, "She has a migraine." I just kept thinking, I can't deal with any more pain, because prior to the diagnosis, my husband was bathing me and dressing me. And then I have this migraine, and now they're going to put a needle in me. And I was like, I can't deal with this. But they knock you out for a half hour or 20 minutes. And you wake up, and oh, that was a nice little nap. No big deal.
they don't offer that. They never have offered that where I go.
You need to demand it then.
You basically give
Yeah,
me leather to no, but it feels
no,
like
I think that's kind of standard practice now. Is
We
to
requested it.
give a light anesthesia.
I will request that next time.
Absolutely.
Yes.
Demand it.
I haven't
I get
had
a-
a couple of years, but I've had quite a few. And each time I'm like, you got to give me something. You got to do something for me for the pain, because, and I know it's not for everyone, it's painful, but for me it is. So
I can't imagine not being.
I have to say I like Dina's approach. She's absolutely right. You don't request it. You say, this is what I want. Because
Yeah,
too often, if you request it, they'll say, oh no, we don't do that here. And you don't want to hear it, because then you're arguing with them. You walk in and you say, this is what I want. Or you put it in writing to them ahead of time. I'm coming in, I will want a anesthetic if you're doing a bone marrow test. And you know, when we're as patients overly deferential to our doctors, we open up issues that become much more difficult to manage. If we tell the doctor what we want and not ask the doctor, then the doctor has to find a good reason why they won't do that. And as in AnCan, through all our groups, for all the different conditions, we try to tell people, it's right here, be your own best advocate. That's why it's right on the shirt. So it's a good, that I've been working on my buddy Al on this one for a while, and he's getting good at it.
very good. I see that.
It's like with the low dose naltrexone. I had been doing research on it. I found out about it from my compound pharmacist. And then I went to the doctor who believed in it and is studying it, And the other two people were like, I have no idea what you're talking about. I've never heard of it. I'm like, okay, see ya. Move on.
So I want to come back to Debbie on a couple of things. My first question is really for Michelle. If Debbie was to ask Dr. Newman, or request directly, and again in writing from Dr. Newman, a FISH test and say a Foundation Medicine liquid CDX, would that help, having that in hand when Debbie went to City of Hope, rather than having to get it once she gets to City of Hope?
Well, I've also found through other patients and even myself, sometimes these cancer institutes want to do the test themselves. As an example, Is that a purr or is that a groan?
I think she needs to get down. Okay, down, sweetie.
As an example, I was diagnosed
Okay.
and they had done a fish
Sorry.
test, except I didn't even know what that was at the time, in one place. And then I went to Dana-Farber and they did their own tests, and it was within 2 months.
Yeah.
So I have found that that does happen. You know, they want to use their own equipment, they don't, whatever. I also know though, during when COVID was at its height, they were starting to accept blood work from other places. And I don't know if that's continued, but to answer the idea what you were saying, Rick, all they do is, and your appointment's in next month, but how, like in 4 weeks, 5 weeks? It does
4
take a
weeks,
while
I
for the
think.
fish test to come back.
Yeah, 4 weeks.
4 weeks.
If, depending on if they do it in-house or send it out, it might be the same amount of time. And if
They send it out here and it takes less than a week. It goes to
So
San Diego.
So I think, Debbie, what I
Oh,
would,
you know what? I did have a test that went to San Diego
That
because
was a fish test.
I saw that come back and I thought, well, that's strange. San Diego. Okay, so that was probably it, huh?
so why don't you check if that was your fish test, and if it
Okay.
was done, and then next generation sequencing is so important these days, and it's just a blood test. They just take a blood draw and they'll send it off, and it's covered. It's certainly covered by Medicare, and it's covered by most insurance companies right now. So it couldn't hurt to ask Dr. Newman, to tell Dr. Newman that you'd like a next generation sequencing. They may use a different lab. They may not use Foundation Medicine. They may use I forget the names of the other labs right now. I always forget. But
LabCorp.
no, LabCorp doesn't do NGS.
Hmm.
So for NGS it would be I'm having a little brain fog myself. I'll come back and tell you in a second. I've just got
Okay.
360 something 360. No, I'm not getting any help. But the other thing to do is to send a note through the portal at City of Hope and ask them, should you request an NGS test now, so that you have it when you see her.
Okay.
The other thing I wanted to mention to you was that, and there's good experience here, so you can talk to some of the people on the call, this concept of having a quarterback doctor and then a local doctor.
Uh-huh.
It's really, most of the doctors we're finding now in the centers of excellence like City of Hope or Dana-Farber are much more willing to work with local doctors when they have patients coming in from a long way away. And
Right.
they may even know people in certain places. And we often tell our people where they're looking for a specialized genitourinary doctor, speak to the doctor, ask them if they know somebody locally, so you don't have to go 3 hours to get a chemo session, because chemo's chemo. You can get it
Dr.
in
Newman is already working with City of Hope with me.
perfect.
Yeah.
So so that connection already exists, and he's
Uh-huh.
happy to do it.
Yeah. But I thought it was kind of sad. Well, I did think it was sad that I was the one who had to say, should I get be seen by a specialist? And immediately he went, oh yes, go see Dr. Siddiqui at City of Hope. And I thought, oh, interesting. Was he even going to offer that to me or suggest that to me? I don't think so.
Well, that's why you have to be your own best advocate.
Right. Yeah.
And that's why
That's why you met me.
that's right.
That's right.
It's true. And when you come to a group like this and you learn what you should be raising with your doctor,
Right.
and so it improves your treatment.
Yeah.
And it does. And that's why, we were all talking about the bone marrow biopsies. So I guess my last one was so long ago, I hadn't ever been in a support group meeting yet at that point. So I didn't know enough because I hadn't talked to other patients and heard all this from them to know that there was any other way to do it other than toughing it out.
Oh,
So
yeah.
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 Well, I've done it both ways, and I'll ask them to put me under every time from now on.
and
Wonderful dream time.
what is it they put you under this quick
I think it's
like,
propofol. I think it's the Michael Jackson drug,
Yeah,
propofol.
that
It's
and a little fentanyl.
Oh, fentanyl. Yeah. It's what they use when
after.
they do a colonoscopy.
Okay, I didn't know
My
they violated me.
the one that made me decide that I will never have it without sedation was the one that Dr. Krishna tried to do at the City of Hope. She could not get through my hip bone. She said my bones were too strong, and we left it. My patient advocate stopped the procedure, and we came home to Santa Barbara to have it done.
Oh, wow.
Dina, are you okay?
That just sounds so horrible. I mean, that is just barbaric.
It
My
was.
doctor told me, so, when this all first happened, my husband said, well, what are we going to do about her pain? And he said, well, she should be out of pain soon as we start the therapy. She should be out of pain soon. And he promised me, he said, there's nothing I'm going to do. Nothing about this is going to hurt. And it really didn't, except for sometimes, like, it took them 7 times to get in an IV recently.
Oh,
3 people, 7 sticks. They're telling me my skin's thickening, so I go to the dermatologist and blah, blah, blah. And then I get 2 more that are perfectly fine. That was at an Emory different location that I was told not to go to, but it was closest to the house. Instead of driving an hour, it's 3 minutes from work. Yeah, won't be going back there. So, but yeah, basically nothing hurt because if something was going to hurt, they gave me meds. So I really liked that. It's less scary when you're afraid of the pain. That's part of it. I mean, you're afraid of dying, but you're afraid of the pain.
yeah.
So, yeah, I don't know why they would torture you like that. It's horrendous.
it's really like, I don't know if you've looked at one. It reminds me of a corkscrew. It's like a medieval,
Oh,
I've written about like a medieval
stop,
torture
stop,
device.
stop.
Yeah, I know. I do
Well,
have pictures.
it was my first one, so I didn't know what to expect. And everybody said, oh, you can take it. And they give you the lidocaine, but, my patient advocate, who was an ex-nurse, said they didn't wait long enough for the lidocaine to take effect, and she tried it 3 times.
Oh,
So,
Yeah, they've
and
Yeah,
tried to.
so Dottie just said, that's enough, stop it. And we did, and we left.
You're lucky.
good decision. My
Now,
doctor
actually,
at
there's
MD
a,
Anderson, my doctor at MD Anderson orders bilateral bone marrow biopsies. That means I'd get 2 at a time, 1 on each side. But
oh,
since I'm out, you know, 20 minutes later,
Doesn't
I'm
make any
awake.
difference.
They roll me out in a wheelchair, and I'm on my way to a CAT scan.
Well,
And
what's the benefit of that? Why do they want 2?
And actually, the benefit is in multiple myeloma, not necessarily as much for the other cancers. It's because the heterogeneity of the clonal portion of the multiple myeloma. You can have a different clone in your shoulder than you do in your hip, and and whichever is prevalent. So, and especially after treatments, induction and maintenance, the next time you get a bone marrow biopsy, you could have a whole different, genetic makeup because multiple myeloma is clonal.
So exciting.
Lynn, did they do that so they would get a greater population of cells?
I never was told why, but I know the result was like 40 to 70%. So I don't know if it was 40% on one side and 70 on the other side. But the other side of it, he's asleep. He's not feeling the pain. Let's be sure we get good samples here. And they use uh, they use electric drills at the MD Anderson. It's not a manual process anymore. I say that I've been told that. So But
I don't know what Emory uses.
but I think part of the reason some people don't have much pain is because the person that's doing it is very skilled. Another part, though, that may have a bearing is how tough your bones are. But uh, I've had it both ways, and I ended up throwing up the first time under local sedation, the pain, and probably my reaction to what I was going through. But anyway, such an easy thing when they knocked me out.
Do you see Dr. John by chance at MD Anderson?
Now, I see Dr. Felipe Samaniego. Dr. Samaniego. He's been there, well, he's about, I'd guess he's about late 60s age-wise, been there a long time.
Well, the only reason I'm asking is a few people sent me, I had forgotten I had done this on a patient power interview. It was with a few different CLL specialists, and two of them were from MD Anderson, but one of them was Dr. John. And he was saying how easy a bone marrow biopsy is. It's so easy, there's no pain, you just go in and have it done. In other words, not needing sedation. And like my co-host was like cringing, Jeff Polidor, another CLL patient. He was like, he was just like cringing. And I said, have you ever had one, to the doctor? And I forgot I said that. And I didn't do it flippantly because I know another doctor at MD Anderson had mentioned once they had one to see what the patient went through. So I didn't know if they all had to do this. And someone sent it to me recently. She's like, thank God you asked that. They don't know how much pain we go under. And I honestly didn't mean to be wise. I did write to him later. He said, no, I know, because it was his former boss who did this, who had it done to himself. So I think that should be part of their medical training if they have to do them. Debbie, do you have questions or things that are concerning you so we can arm you for City of Hope if we haven't already done so?
I'm sort of a blank slate. I need to get information. I feel like I've seen Dr. Newman 3 times, and each time it's kind of a flip. Feels to me like a sort of a flip, oh, you're doing fine, and the blood work looks good, and it'll be 4 years or 6 years before you'll even need any treatment. And then I leave and I go, oh, okay, but so far it's been a little bit confusing, and I don't feel like I've really gotten a lot of information from him.
A couple of resources for you. Besides, and you're welcome to reach out. Please reach out to me if you have any questions, or if anyone else here wants to, and I can. Do we have your email already?
Yeah.
Okay.
Yeah.
Sally, if you want to share that with me, and I'll give you mine as well right here are you in the chat right now?
Yeah.
Okay. I will send that, but also a couple of good resources for you. The CLL Society, and Lynn had posted something from them already in the chat. The CLL Society is a really good resource for certain things and finding certain information. So it's cllsociety.org. I don't know if you've looked on their website yet.
No, I've sort of glanced at some of this, but then I've got this thing in the back of my mind that I don't have to worry about anything for 4 to 5 years. And so I think,
one thing you should stay on top of is about CLL patients and COVID.
Okay.
And how we're one of the worst, most severely immunocompromised types of patients out there, which you may know. Yeah. We're kind of all in this together, but I'm sending you my email here. Sorry, I'm not doing well tonight with multitasking. So there's also Patient Power. Have you been to there?
No.
And they have the various CLL specialists around the country about the latest in treatments, or if there's news of the day, what's happening. And that's a really good resource. And then there's When You're Ready for It. And you'll know better once you go to City of Hope, right? Whether you spending some of your time on this. And that would be online support groups like on Facebook, very generic names like CLL support group.
Okay.
So, and it's a community like this is, but, you know, they're there whenever people are up during the night, they can't sleep. And I know you have them for multiple myeloma, 2 various ones, and you see which one fits you the best if you end up having questions. One thing is, have your numbers been changing much on your blood work?
No.
That's good. That's great.
Yeah.
So that is curious that your doctor changed from you won't need treatment for, what was it, 20 years, then all of a sudden 5 to 6
10
years.
years.
Asking, 10 years. That's why I was asking if anything had changed.
Well, it changed when I said, hey, I should see a specialist. And that's when he was like, yes, do that.
Well, I'm
Yeah,
glad you brought it up. Yeah, I
I
often,
think I think the specialists look at your medical test, but they also look at how you're feeling, and combine those two things in deciding when to start treatment.
Yeah.
And as Michelle was asking about your counts, they're looking at the trend, how fast they're rising in your lymphocyte count, which your white count, but the your lymphocyte follows that. That's what they're looking at. And of
and
course, the platelets, if they're dropping down. And go ahead, Michelle.
I was going to say in your lymph nodes, and you know, I was only manually examined until I already knew I was going on treatment because and you probably even know how to do these exams, Debbie, being a nurse.
Yeah.
But CAT scans really do show, you know, if they're thinking the spleen is enlarged, then of course they'll show, but also they'll show if your lymph nodes are crowding out your organs.
Well, this was funny because initially he sort of examined me and he said, I can't really feel your spleen, so we'll do an ultrasound. So I did this ultrasound, and while the fellow was doing the ultrasound, I said, oh, do you do very many of these? And he said, not so much anymore. Now that there are CAT scans, those are so much more accurate than what I'm doing. I thought, okay, so here I am.
But at least you didn't get the radiation, I guess. That's
No.
one on the radiation.
So Michelle, let's just check in with Al and Lynn and Sally and Jim, just to make sure, and yourself, if you have anything you wanted to bring up in the meeting tonight. So Al, would you like any time to discuss anything that's on your mind? You're muted.
Yeah.
There you are.
No, but what was interesting is that here at Banner, when I had already had a bone marrow biopsy, they wanted to do another one at Banner. And by the time I got over to Mayo, my doctor over there, she said she was not going to have me go through that again.
Thank goodness.
So I don't know.
Did they give you anesthetic at Banner?
I asked for it. No, that was at Arizona Oncology where I had it done.
Arizona wrong?
Yeah, and I asked for it.
Okay.
Yeah, it costed me a little bit more, but yeah, I paid for it. I was not gonna have them do it. There's no way I was gonna let them do it without anesthesia. Yeah, but yeah, like I said, I had it done at Arizona Oncology, and then it was brought up at Banner. And by the time I got over to Mayo, yeah, my doctor over there, she says, "Oh, I'm not gonna have you go through that again."
That's a good doctor.
Yeah.
So
So
they just,
anything else you want to raise tonight?
No,
No.
no, I'm good. I'm good. Thanks.
how are you feeling?
I'm doing a lot better. Yeah, I'm doing a lot better from where I was last year. The brain fog, I was there last year a lot with it. Like, there's probably times I mentioned this before where I probably should not have been driving. It's like I'd go through an intersection and was that a red light? And just being careful though. But yeah, I've done a lot better. And we talked about the fatigue, and I mentioned this before. I am well hydrated, but one of the things that does help me with fatigue are the drip drops, and that's just an electrolyte boost.
Oh,
And that's
thank
helped
you.
me out. Yes. There you go.
Or that.
Yeah, the drip drops.
easier because I buy some of the electrolyte water, like you were
Right.
just telling yours, and we're limited when you order at home. They limit how many you can get. So the drip drops sound like a great solution.
Yes.
I
Yeah.
like the powdered Propel is better tasting than the drip drops.
Yeah. Yeah.
Oh,
You can get powdered Propel, which is the electrolyte drink,
mhm.
and get it at Amazon, and it comes in little packets, and you can just take it with you anywhere.
But I
Can
really do feel
somebody
it. I
can
really do feel it.
somebody tell Lynn about drip drops? He's asking in the chat window.
Oh,
Oh, it's an electrolyte powder that you add to water. I mean, drip drops is liquid. Propel powder from Amazon is a powder, and it just has your, potassium, magnesium.
No, the drip drops are powder also. You put those in
Oh,
your
they
water.
are? I
Yes.
actually got one that's liquid too.
the
But like
name?
Yeah.
I drink Propel, I drink 5 of these a day.
That's great.
And so,
So they're primarily for dehydration.
Yes.
no, well, all of us on all these drugs have to, protect our kidneys and drink
Okay.
at least 80 ounces of water a day.
Okay.
And this has electrolytes in it because we need those too. So,
Okay.
And I have to say, it does make me feel better if I'm starting to feel a little like that hitting the wall feeling, Lynn, or going over the waterfall. For some reason, part of it is replenishing and with the electrolytes,
Yes.
whatever, all the thing about the good things that are in there.
And I do feel it. As soon as I drink it, I feel a lot better after I drink what 14, 16 ounces of it, whatever. I'd like to back up on something. A while back, again, I have lab work done about every 3 weeks. And about 2 or 3 months ago, I had lab work done. And I get a call from my primary doctor's nurse. And she's calling me, and I saw the number, and I'm like, freaking out. What do they want now? And so I answered the phone, and she says, yeah. She says, Dr. Ho would like you to go see a kidney specialist, and we're going to go ahead and send you a referral to get you in and get an appointment set up. And because your kidney function numbers are down, so he's a little concerned. So we went ahead and made the appointment. I went and saw the kidney specialist, and he just by looking at the numbers, he says, I'm not going to call anything out. He says, I'm not going to talk about the book without reading it. So we're going to go ahead and we'll set up, get you in to get some images. And I want you to go back in, and we're going to do some more lab work. So I went in, got the images, and about 4 days before I had the appointment with him, had the lab work done. And so the first time when I went in there, it wasn't till about 5 weeks after that I got the follow-up appointment with him. But the first time I was in there, I asked him, I said, does the cranberry juice or the cranberry capsules, do they help? Do they do anything? And he goes, there's nothing been proven, but if you can afford it and you got the money, he says, go for it. He says, that's fine. So from that appointment up to my appointment when I went in and before the lab work I had done and the images, I was drinking a glass of cranberry juice every day. So by the time I got in to the follow-up appointment, he says, I don't see nothing. He says, all your numbers are normal. He says, as a matter of fact, your kidney numbers are better than mine.
Wow. Is that your what is it, AST or ALT or something like that?
Yeah,
Oh, yeah, I don't know.
yeah. AST and ALT is right. Yeah.
My
Nurse Mona, isn't that right? ALT and AST for kidneys? I have to check with it.
because mine were fluctuating like crazy, and my oncologist, my CLL specialist was like, these things happen. It's like I was freaking out, and I started taking those cranberry pills, and then somebody told me that maybe that made them go haywire, and I'm like, oh gosh. And then someone else said cut out cinnamon. I'm like, well, I put cinnamon in my coffee every day or my yogurt. Cut out cinnamon. So now they're normal, but it's true, they went back to normal, and I have no clue which thing did it, or if it just went back to normal. So I
Yeah.
think, so yeah, she was right. Thank goodness that she's right. So you're feeling good though. I would have been worried about that, Al. I'm
Yeah.
sorry you had to
No.
go through that.
Yeah, I was freaking out myself, you know. And then back to the fatigue. Again, I've gone round and round with Rick on this because he wants me to exercise, but I'm too tired to exercise. And if I do go out and exercise, like even if I do a project around the house where I exert that one day, I pay for it the next 2 or 3 days. I'm on the couch. I'm really drained.
Yeah, because you've got to do a little bit. When you
Yeah,
know, I mean, you've got to get out, you've got to do, and you start and you build it up. When you're working that big project and you're working hard all day and you're lifting tiles and what have you,
yeah. No, I
you,
do. I do. I pace myself. You know,
you've
if
got to do just a little bit and get out
yeah,
and do that little bit.
yeah. No, I do. I take a lot of breaks. I mean, if I was to go do what I do and work for someone the way I do, I'd be fired.
Well, your wife didn't fire you when you built that new shower. Yeah, that was because he had his wife laying the tile and not him.
I couldn't, I couldn't get her to help me. You know, I tell her, I need you to help me. I said, just shadow me, shadow me. I changed her name to Gasper, the friendly ghost.
Well, Al, I'm glad you're doing well, and
Thank you.
it's delightful to see that.
Thank you.
Lynn, is there anything going on with you since we last met?
Well, I've got two things to bring up, kind of go along with the discussion today. Um, and and I just take my pill a day, my Brutinib, and so I'm doing fine. Was in MD Anderson in August, and I go back again in 6 months, and then in a year I will visit again and have my annual CAT scan. But I think it was Dina. Somebody was talking a while ago about um, getting a blood draw and got stuck 7 times. Was that you, Dina? Yeah. That. So the question: uh, what do you do? Each of you, what do you do when you go in to have something like that done, a blood draw, and or an IV for treatment, and they're having trouble getting a vein? Do you set a limit? I want somebody else after 3 sticks, um, or do you say I want to have a port so I don't have to stick me in the vein? What? Um, Let me just throw that out there for comments.
Debbie, can you unmute yourself?
I was going to say that the new rule is that 2 sticks and that's it. Somebody else has to try it. And I had surgery recently, and it took 3 different people. It took the anesthesiologist who couldn't get me, and then it took the nurse who always gets in, and he couldn't get me. And then they sent in this old ER nurse who was about 100 with her little basket, and she couldn't get me. So at that point, I said, okay, that's enough. That's 6 sticks. We're just going to let it go. So I had one very hardly working IV, and we left that one in. But that's the new rule. It's 2 sticks, and then they find somebody else.
Wow.
I just tried to drink an entire bottle of water about an hour before the labs, and that helps puff up the veins and everything. And
Yeah,
like
great
Debbie
idea.
said, I'll go for 2. If they can't get it in 2, then I'll ask for somebody else. But I'm going to have a tattoo put on the exact vein where it always works. So, but a port's not a good idea unless you're, doing a lot of,
Mhm.
every week, 2 or 3 times a week, because a port can get infected and you have to clean it and you have to, I only had the port, during harvesting and my stem cell transplant, but
So,
I know
son,
there's a.
is that
Uh,
tattoo going to be like a big arrow with a
yeah,
like a big arrow with a point?
well, I know
yeah.
there's a special instrument they can use that illuminates your arm Anybody
Uh-huh.
ever have them use that to help find the vein?
No, there was a gentleman in the chair across from me recently. He was quite old and so tiny, and they got out that light to use it. And then a friend of mine who is an ER nurse, she said that they can get like an ultrasound machine to use it, and that's what they'll use in the ER. So you
Okay.
have some options. But yeah, I always drink a bottle of water going in.
Yeah, I think Al was going to say something.
Yeah, when I go in for my phlebotomies, they tell me to drink a lot of water the day before. And when I do go in there, they use a heating pad before they go
Okay.
in.
Okay.
Wow.
Yeah, I wear long sleeve shirts so that my arms are not cold. Be sure if everything's warm. Well, the other thing I was going to ask about is anxiety. I find that, of course, I just recently turned 74. That may be part of it, but I find I'm more anxious about not so much about the disease, although I do get anxious when I go for medical treatment or medical checkups. But it just seems like, like driving in traffic, like we just drove over here to Dallas, the traffic. I just, it's such a relief when I get to where I'm going, and I'm thinking, I know it hasn't always been stressful like this, and I don't know if this is a side effect of some of the medication I'm taking, or it's just, in the brain fog. You worry about, am I going to be able to make the right decision when I get to this intersection? So, anybody else deal with that? That's
Mm.
great. Nobody else
I,
has that problem.
I have to say that different types, I did have different types of problems when I was on treatment. And I did start wondering, but of course I never shared this, if I was like, so is this because I'm worried, or is it from the treatment, right? Like that idea of the judgment or questioning about driving. Part of me was wondering, like, am I supposed to be driving? I feel okay to drive. And then I'd be wondering, but maybe I shouldn't. I don't know. So I don't know where, which it is. Is it brain fog from treatment? Is it because of what the treatment has done in the past? Is it because you're emotionally, there's something you don't even realize that it's bothering you, but you think you're fine? I don't know. I don't know if that's something anyone else has ideas on. And Lynn, if you've wondered about that yourself, like, what is it? It sounds like you
Well,
have.
yeah, I've wondered about it because I've added some more medications. Flomax, that's for guys who have
Yep.
prostate interfering with flow from their bladder, and with added what was the other? Oh, I added Lipitor, um, and so those are two new drugs for me. But but
Well,
I, you know, I,
I want to address the anxiety, Lynn, because it's a huge issue for anybody living with a chronic disease,
Mhm.
and it can arise from so many different things. Not obviously not knowing the future, because that's what I think I've read this to you before, but I have it here on my desk that if you're depressed, you're living in the past. If you're anxious, you're living in the future, and if you're at peace, you're living in the present.
uh,
And I love that. It's and I have that pinned to the bottom of my computer screen here. So and a lot of people have huge anxiety over their tests. Scans, we call it scanxiety. Waiting on test results is another thing. We actually had a webinar scheduled for November, and we decided to push it into next year. But we are going to do a webinar, and I'm hoping that BJ Miller will moderate it again. He's a very well-known palliative care doc, and of course, the only problem with BJ moderating it is we don't know what we're going to get. So it can go in any direction, which is what happened with our healthcare, our managing your healthcare team, which turned out to be fascinating because we had a bunch of docs telling us what they saw from the patients from the doctor's side, which you don't usually hear. And it was a great webinar. You can listen to it on the website. But that said, we do recognize it as an enormous problem. I'd separate it from brain fog. I think the anxiety is a whole different set of issues from the brain fog, which is also really common with a lot of different treatments. I mean, I know what I did for brain fog was I made myself use my brain intensely for at least an hour a day. So I would sit and play a rubber bridge, for example, each night, however long it took, because I'd have to be remembering what cards had been played in the past. Or some people do Sudoku, some people do a crossword. I mean, there's a lot of different ways you can do that, but it certainly helped. And I never thought that my memory would come back, ever. And I mean, now I'm dealing with hundreds of patients, and it's amazing. Sometimes I surprise myself what I can remember. I can't remember words that I want. I've lost that. But I mean, I use the thesaurus about 3 times or 4 times a day because it drives me so nuts. But so we watch this space. I'm drawing up the webinar schedule for 2022 this week. In fact, I've got to finish it up tomorrow, and we're going to have we'll have a whole webinar on health anxiety. It doesn't get talked about enough. I mean, I love what Dina said before. I mean, Dina has a psych-onc on her team, and we've talked about these oncological psychologists or counselors. And one of the things I'm working on with Foundation Medicine right now is that they will provide an oncological psych counselor from the moment you ask for your test till the moment you get your results that you can call up and you can talk to. And I'm really hopeful that they're going to do that. It's come up. It may take, it may take a year to get it done, but these big companies, if they put 3 or 4 people in place, it's not that expensive in the overall scheme of things. And it's a fantastic facility for the patients when they're going through some of these major tests.
I attended a webinar this morning on the emotional side effects of, actually it was a stem cell transplant, but it turned out to be of cancer. I will have a video copy of that tomorrow, and I will send it to Rick, and he can send it out to anybody. And it was a very good conference this morning.
Well,
So,
I'll tell you what we'll do. Well, if you write up a little thing with it, we'll put it in the blog, and we'll post it on the blog, and we'll send it
okay,
out.
and it'll be a YouTube video. Yeah.
Perfect. And you'll give us just write up, a page, less than a page, whatever you want to write up, and Alexa will put it into the blog, and we'll put it out on social media as well.
Okay.
Oh,
So Lynn, oh, I'm
I'm
sorry. I
sorry.
was going to say, Lynn, yes, I have anxiety almost every day, and it's not always the same thing. It depends upon what's going on in the day. Like recently, I've been really anxious in the morning because I have so much to do, and I know I'm going to crash. And how am I going to get all this stuff done? And some of it's, it's important stuff that has to be done. So that might give me anxiety, depending upon the side effect of the day. I don't know. I have a lot of anxiety over how much do I want to know? Like, obviously, you are all doing your research and are very knowledgeable, which is my general way of living. But then, is it too much? Is it overwhelming? I mean, I get so many texts and emails a day and this, that, and the other that I can't focus on other things. So, what do I cut out? What do I keep? And then do I want to go into the peer counseling availability to me to help other people, which is something that I would tend to go towards, and that's the kind of thing I love. But is it going to keep me in the world of cancer? Is that going to be too upsetting and depressing and cause more anxiety? You know, depending upon the call that I'm on, the Zoom call, hearing some of the other things that people go through will just make me spiral. Um, I think what your experience is really normal. Yeah, and driving and forgetting where you're going. And like,
That I've
oh,
done.
I wasn't going to the grocery store. I was supposed to be going to the post office. Oh, you know. So I feel your pain. You're not alone.
Well, it's good to talk about it. And
Great.
I think you sometimes we do need to take a sabbatical and get away from certain aspects of our life, and part of it might be to take a vacation from Facebook or from something just that stresses you a lot. Just to maybe it's what Rick's been pushing us to do. It's to get out and get that walk and get in the outdoors, because
Every
that is
day. Yes.
that is a stress reliever to get that exercise in.
Oh,
Tina,
taking a
how did
walk. I mean, I prefer to be in the woods, but if I just have to go around my neighborhood, that's great. The other thing that's helped me tremendously through all this is an app that I use called Calm. And it's a meditation. It's a 10-minute meditation, but there's a lot of talking, and there's like a concept of the day that she discusses, and then I journal about it. And you know, at first it was just a pain, and I wasn't getting it done, but I knew that it's the right thing to do. And now I just, you know, I can't wait to do it, to just kind of settle in, and it grounds me for the day. And I swear to you, 99 times out of 100, it is a message that I needed to hear that day. You know, I know those things don't really work, but I'm like, oh, you know, it's there for, you know, however I adapt it to my life to that day, you might adapt it to your life in another way. And that has really helped tremendously with just grounding me. And there's something about getting those thoughts onto paper.
Writing.
Tina, how did you? I'm just curious. How did you come to hear about this group?
Kevin, who is in my cancer and COVID group, which is
Okay.
another Emory group run
Okay.
by a social worker. And out of the whole Emory Winship group, which are thousands of patients, it's me and Kevin. So we meet once a month and we just have a grand old time, the three of us.
All right. Okay. Well, we're delighted that you made it, and we'll love to have you back. So now, what about Sally and Michelle and Jim? Jim, is there anything you wanted to bring up tonight?
Oh, yeah. Can you hear me now?
Yes.
Yes.
Oh, good. Anyway, I have a laundry list of things. Anyway, I am essentially the odd guy out. Prostate cancer, within the lymphatic system. So anyway, I'm here because of that. The first thing is about fatigue, okay, and the brain fog. Anyway, I've been on meds which are suppressing my testosterone now for 4 years. And so I started out with the fatigue and everything else. Okay, and I found that then I was tempted anyway to flots, okay, on the couch. Okay, and the more I flotsed, the fatiguer I got. So then anyway, I tried, okay, exercise, okay, especially on a bike. And I found out that provided I did that, I felt a hell of a lot better. Okay, and the brain fog happened to disappear too. So today or now, I think I ride the bike about five days a week, okay, for about 30 to 45 minutes at a time. And it's great. And then also hydration. Hydration is essential. Excessive hydration. Unfortunately, if I do that, I am up probably during the night about 4 to 5 times, but it's okay. I don't hurt. Blood draws. Okay, I get my blood drawn every 30 days. And so I've learned that I ask for the hose. I always ask for the hose because I get about 6 to 7 vials, okay, out of me. Okay, and the hose I've looked at has a little tiny needle. It is minute. It's amazing. It hardly ever hurts, okay, to go in. Then other than that, the thing that I'm trying to do happens to be to learn it all. Anyway, I was in the military, and I figure that this is some kind of a war, okay? Okay, and there's a thing out there which is attempting to kill me. So I want to know everything about it. I want to know, okay, the good parts, okay, I want to know, and with the bad parts. And so, and with the more I know, the more easy I feel about it. So, and where I can attack it, okay, because it is attacking me. So let's see, other than that, I'm now, as I said, 4 years. And I think I told this story to a number of the other folks here, but I think it's interesting. Over the VA, okay, I'm a VA disabled vet. Okay, I am technically 200% disabled, and because of the drain of the testosterone, the VA has determined the value of me in the bedroom, because now it don't work anymore. Of course, I'm actually 77 years old, so it, you know, didn't really work that good, but now it don't work at all. So the VA has determined our value in the bedroom. So in the ladies out there, I want you to look at your husband and ask the question, is he worth $111.74 a month to you? And are you getting the full amount every month? So I get that extra, would you believe, on top of, okay, everything else I get. So I thought it was interesting that the government sat down and somebody said, what happens if it ain't there or the thing don't work anymore? And they actually had a meeting, probably a contractor was in, you know, attempting to determine the value of us in the bedroom, and how they happen to come up with that amount. I have no clue.
So it's a very great hard number. We won't ask each of the ladies in turn whether they think they're getting their money's worth. But we will ask Sally and Michelle if either of them had anything for tonight that they wanted to bring up. Sally.
I'm coming back. The connection is really bad.
Okay. Well, while Sally's coming back,
there we go.
Oh, here she's back. She's back. Anything that you wanted to raise tonight for yourself?
No, I just wanted to say that I'm really excited about learning from both you and Michelle on how to do this correctly, because you do it so well. And just, you know, I'm sorry that so many of the other normal, I didn't mean that word. Regular people aren't here tonight. None of us are normal.
That's right.
But I'm looking forward to it, and to add my 2 cents worth where it's appropriate, and glad to see the new people here.
Yeah, me too. And what about you, Wonder Woman?
Well, I am delighted to have Sally with us. Sally, you're a natural at this, and I'm happy being abnormal and not a regular kind of person anyway. So, we all know that. Anyone else who like parades around in their Wonder Woman outfit, come on. So, Wonder Woman will have more to share probably next month.
Michelle, check that out, Michelle. You got competition.
I knew you're my kind of gal. I don't know if you can see behind me. Everyone has seen it. I have like a shield and the swords and a whole Wonder Woman.
Here's what I'm gonna do. I'm gonna put the link to the Wonder Woman post on our blog. We have a Wonder Woman post on our blog, and I'm gonna put it in the chat window so that the new people can see it. I'll do that. Keep talking, and I'll do that very quickly.
Well, Wonder Woman's calling on all her resources because my test did not go so well last week, my appointment. So I'll be retested just to make sure it's not a fluke, but it appears that my CLL has escalated incredibly quickly in the last 3 months and that it's time for treatment again. So I'll be finding out more in 4 to 6 weeks, and I'll have more to report in. Next, I might be back on treatment next time I see you all.
Oh,
So
well, we don't like to hear that.
No.
So Michelle, how long were you off treatment, and what was the treatment?
2.5 years. I've been almost 2.5 years I've been off, but my numbers went, like I said, in 3 months, they went from barely being out of remission to this. It's like from 0 to 100, miles an hour. So pretty surprising. My lymph nodes my lymph nodes are crowding out my organs right now. So the doctor is hoping that perhaps, the blood counts could be an immune reaction to the third vaccine, meaning it worked, and they're still calming down because I just got it a few weeks ago, but the lymph nodes all over, she's not so sure. So we'll see. So I was on a clinical trial of FCR full strength and ibrutinib full strength for 6 months, and then I was on ibrutinib in total for 4.5 years.
Okay.
And so the FCR is supposed to throw you into a deeper remission, the addition of that at the beginning. But this was, I started at the end of 2015. We're talking about a long time ago. All these other drugs didn't even exist that exist. And ibrutinib hadn't even been approved for frontline treatment yet. It almost was a few months later. So, so they don't know, because I'm in the first cohort of that trial. So they don't know how long really these remissions last once you're off treatment. They're finding out now. So, and Lynn, you're on, I know.
I'm on ibrutinib 7 years, and I was going to ask, were you MRD undetectable?
Almost
Okay.
there, 0.04%. I still, as opposed to 0.001%.
Okay.
And are you at that MRD negative?
No. I think I'm. The last time they told me was 2 in 10,000, but it's not expected on ibrutinib by itself to go into a deep remission. Just controls it.
Yeah, as long as I was on it, it controlled it beautifully, and actually in that way until 3 months ago. Well, it started coming back probably a little before that, but not much. So, and they, that's because it's,
and I'm 11Q and 13Q and unmutated.
we're almost twins. I'm 11Q and unmutated.
Okay. So the unmutated would tend to say that FCR would not be effective.
No, they didn't know that back then.
Yeah.
At least
that's right.
So as we all see, things just change so much,
So
over
Michelle,
time.
have they given you a benchmark, and if you get to a certain biomarker, they will intervene, or how do they decide when they're going to intervene?
CLL is such a crazy disease that it's different for different patients. So, I'm feeling fine. So that's the one wild card. I'm feeling fine. I haven't slowed down, although I will say that physically it's bothersome. I can feel that things aren't, like I look at night, not to ruin your image of me as Wonder Woman, but nighttime I do look like I'm quite pregnant because their lymph nodes, there's no room in there,
Yeah, yeah.
So other than that, yeah, so
How
it's
about
just, hmm?
how about the other B symptoms? The night sweats, weight loss.
Well, I've never had the weight loss. I was just happened. So that, and so that I don't think has happened unless I'm retaining fluid. If I am retaining fluid, because I know sometimes you lose that weight immediately when you go on treatment, then perhaps I have. Because I'm like, my arms seem smaller, except my weight isn't much different. But yes, night sweats. But at my age, it's like you don't know. Even my doctor can't tell me. Is it due to age, or is it due to CLL? Are they hot flash night sweats, or are they CLL night sweats? So that with women, they have a hard time determining.
So let me give you a quick tip for the night sweats if you're suffering from them. And we've been trialing this with our guys in the prostate group. There's a gizmo called the EMBR, EMBR Wave. It's made by Ember Labs, EMBR Wave, WAVE.
Mm-hmm.
It's a little watch-like thing that goes on your wrist. They've actually just come up with a second generation that's way smaller. No, it's EMBR, Lynn, and then a second word, Wave, and look up Ember Labs. And it regulates these hot sweat, these night sweats.
Wow.
And the guys are swearing by it. It has a setting. Ember Labs Wave, WAVER, like in Seaway. Okay?
Wave.
Like Wave, yeah.
Okay.
Ember Wave. And it really works. Now, the guys are getting it for free because it's in a clinical trial, but we've also known some women go after it. That's it, Ember Wave, you got it. And it's Ember Labs, and it really, really works. So
I'm ordering one of those tonight, no matter what those are from.
Yeah. So check them out, and aren't I right, Jim Marshall? All the guys hold up their wrists and they.
Oh, absolutely. All of them happen to hold it up there, and they're all cheering and happy and everything else.
Yeah. They say that there is a night setting during the day. You have to hit a button when you feel the hot sweat coming on, and you have to do it quickly. They say if you do it quickly during the day, but during the night there's an automatic setting. I don't exactly know. I can tell you that I suffered badly. I mean, I was getting 20 to 25 hot flashes whilst I was awake, and goodness knows what when I was asleep. But they didn't have an Ember Wave in those days. So anyway, before we go, I'm going to share my screen for the benefit of Dina. And there you go. So this is our lady showing off her wares. See, is Al still with us or not? I can't see if Al's still with us, but yes, he is. This was for Al's benefit. He loves that photo. You have to sign. You have to sign one of those photos and send it to Al, Michelle. So,
Will do.
I could use that for my background on my computer. My
There you
wallpaper, my wife would probably divorce me.
Just tell her she's a patient advocate friend. That's
Oh,
all.
It's on,
okay.
it's on my Echo picture gallery. So people come over, and when it's flashing the pics on my Echo, they say, "Who's that?" I say, "Oh, that's Michelle."
I'm turning red. Dina, we need to get you outfitted.
You're muted, love. You're muted, Dina. Anyway, there you go. Are you
Fine by
ready
me.
for?
I said, fine by me. Let's
There you
Oh,
find a
great.
costume.
That's the spirit.
Hey, listen, we could have the Wonder Woman troupe.
We could.
What do you think, Michelle? We could have a troupe of Wonder
Sally. Only if Sally does it too.
Woman.
I gotta get some
know
hair
it.
back. Wonder
I
Woman
think
has
I
hair.
want to be Venom.
So you can pick your own superhero to be.
Right.
Well, it
All
sure
right,
has been
guys.
enjoyable.
Yeah, thank you so much, everybody. We hope Dina and Debbie will see you next month. I think we've got your email addresses. We'll make sure you get the reminder before next month.
So
And we'll see you then. And thank you,
actually,
Lynn. And just reach out to us if Dina or Debbie, Debbie, you know how to get hold of Sally. Dina, info@ancan.org. If
oh yeah,
you
Dina,
need,
can we have your email? I had sent you a little chat note. I don't know if you answered it yet for your email, so we can add you to our.
Sure.
we
Right
have it.
right here in the message?
Oh, we have it.
Yeah, Dina must have registered with it because I checked.
Oh,
So
Well, it
I'll
asked me when I was trying to log in, it wanted my name and my email.
right. So we do have it, but I'll
Oh.
send it to you, Michelle.
all right. That's great. And are
Okay,
you
and then the Wonder Women can commune in Wonder Woman land.
I've decided I want to be Storm.
I like that. Storm.
My family
Well,
will call me Storm.
I want to be Peter Pan and never grow old.
Okay,
Thank you all for
guys.
being with us. It's been
Good night, everybody, and thank you.
Good night. Good night.
Thank
Good
you.
night.
Oops.